Hey guys, welcome back to my YouTube channel. My name is Elma, and this is Space for Inspiration and Change. If you're new here, you're very much welcome, or you're seeing my face for the very first time, you're welcome. This is our space for inspiration, for joy, and for happiness, and all good things, okay? And if you're a returning subscriber of mine, thank you. Thank you for always coming back to support me. I really, really, really do appreciate your support. I do appreciate your love. And I just want to say thank you to you all. If you're new, please consider subscribing. Thank you. So today's video, I want us to talk about something, okay? Like I said in my last video, someone requested to like know about life in Korea, okay? So slowly I'll just be giving you all a little updates about life in Korea in general, or how Korea it's like I'll be picking different aspects at different times to update you all about how life in Korea is, okay? So today I'm going to be talking about the healthcare system in Korea. A very important thing we need to consider is insurance, okay? Without health insurance in this country, you can pay so much money. Like every student has to have a student insurance, okay? Even ordinary people like who are not students, even permanent residents in Korea, they all have insurance. But here is the thing, like when we came to Korea, first of all, our school enrolled us for like a private insurance, okay? So at one point I became sick, and okay, before that, flashback to before that time, Korean government was changing their system whereby they were compelling every student, to go in for the government insurance, and we are trying to fight it because at that time we didn't know the importance or the benefits of insurance. Because in Cameroon, I'm a Cameroonian, by the way. If you're new here, I'm a Cameroonian who is based in South Korea. So in Cameroon, we don't even know anything about insurance. I only know car insurance. I didn't know anything about health insurance. I even don't know if there's anything like that. Now, coming to Korea, coming to Korea, we were paying the private insurance at that time, and Korean government was compelling us to pay the government insurance, and we're like, what rubbish? Why we were paying $200 a year for our private insurance, and now they were compelling us to be paying at about $60 per month, which is like by far more expensive than what we were paying before. So at the time we didn't know. We're like, why this nonsense? Why are they fights? Why are they forcing us to pay this amount of money? We didn't even know that it was for our own good. Fast forward to now, I became sick, and that was when I got to understand the importance of insurance. Like we were paying the private insurance, and this is how the private insurance worked at the time. Like if you're sick, for example, and you go to the hospital, you use your own money to pay, and that private insurance was covering us just like, let me say, 60 to 65% or something, like between, was it between 60% to like 80%, I'm not really sure, but it was within that range. And when you go to the hospital to consult, first of all, you have to use your own money to pay, then you go and file in later, then for them to give you like an amount equivalent to the percentage of insurance they are supposed to cover for you. I don't know if you're understanding what I'm trying to say. Now when I became sick, I remember that with the private insurance I had, going to the hospital, one trip to the hospital, I can spend like $500. You can imagine that. That was too expensive. But now, as at the time the government was making us to change to the government insurance, when I realized that. And then the fun with another limitation about the private insurance is that it doesn't cover certain kinds of sicknesses. It had so many limitations. Now, um as at the time I became sick, I was struggling to now go into the government insurance, but it was already like, it was not yet the time. We still had like 2 months to wait before they had to integrate us into the government insurance, and it was so expensive with the private insurance. Like I had an insanely high amount of bills that I would not have had if I had gone into the government insurance. Now, March 2020, we were switched now to the government insurance, and believe me, the change was massive. Government insurance. The benefit of the government insurance is that um it's not like the private insurance where you spend your own money first before they start refunding you some part of the money. with the government insurance, like there and there, if okay, like in for me right now, government insurance covers me like 90%. But for other people it's 85%. But before it was like between 60 to 75 to 80%, which was really not the best. So just imagine the difference now. How if you go to the hospital, they just calculate your bill. Like before with the private insurance, medication I used to pay like $400 for, right now I can pay like maybe $10 for the same kind of medication. So you see the massive, the massive gap. Like government insurance is really really effective. At the time we are fighting it, we didn't know its benefits. Still, I went into that situation and I realized that wow, this was really what I've been missing. Imagine that. So I used to go to the hospital only for consultation. It would be like doctor's consultation would be like $100. Or sometimes I'll be like, what is this with the private insurance? But with the government insurance, it came to like doctor's consultation fee can be like $10 or $15. It all depends on what I have to do on a particular day if I have to see a doctor. So you see, like people get women easily go to the hospital, especially for women. You become pregnant and when you go to the hospital, you'll be expecting an insanely high bill, and when you get the bill, you'll be shocked like, what? This is all I have to pay with the government insurance. But with the private insurance, you empty all your life savings, still you will not be able to pay. And when I was under the private insurance, when I think I exceeded the amount that they were supposed to cover me, and when my bill exceeded like a certain amount, they told me this is where we stop. Like we are not going to pay you again if you exceed this amount, because we are not going to cover you that much. And that was how they ended it at a particular point. And another, I needed to start struggling on my own or through other means now to meet up with the payment. Now going to the doctors and the nurses, what I can say is to be honest, it's like any other place where you meet good people and you meet bad people. I've met doctors who like maybe I don't know, like they've been a little bit I can say a little bit careless or something. Let me just, I don't know if I'm using a harsh word, but who have really been a little bit, let me just say a little bit careless, yes. And but generally speaking, to be honest, the healthcare system in Korea is really nice. It's really good. They're very patient with you. They follow up your medications, they follow up your treatment, and their drugs are very effective, as I can say. Like if you're feeling some kind of thing and you take drugs in Korea, I used to hear that drugs in Korea are very effective and good, but I've seen it myself. Yeah, drugs in Korea are very effective. You can be feeling something and then you take this medication and before you know it, it's working. You get. And also, like I can say, their medical team, like Korea has a lot of like in other cities, for example in Ansan, there's even a free hospital for international people. Like I've even gone to that hospital to consult, and they treated me and gave me medications for free. I didn't pay anything. You see, those are the little benefits about their healthcare system here in Korea. They have those kinds of places where, and that particular hospital in Ansan also helps women who are pregnant and at the after giving birth, like the first years of the child's, like parents who are working, they go there and keep their children in the daycare for free, courtesy of that hospital. So those are some of the benefits you have, like if you're in Korea. And as I said, their healthcare system is good, their staff is good, they are kind, they take care of you. Like when I was sick, I saw old people in the hospital who they didn't have caregivers, but you see the nurses very vigilant, they watch you, they are there to assist you. When my husband was with me in the hospital and when my husband left at some point, then the nurse came and told me like, oh my god, you are going to be so lonely now, I'll be coming from time to time to check you, to just make sure that you are fine. There was this some Korean women who were there, and they were like, they'll feel lonely and they'll be crying, and you see the nurse, like I saw how that nurse ran to come to this woman and she was comforting her, don't cry, don't stress yourself, just take it easy, all is going to be fine, and those kind of things. And I'm like, wow, this is really really good. So for me, their healthcare system is good, their medications are good, they have good medical staff. It's just like it's just that out of every good, like there must always be bad ones among the good ones. There are a few, like I've had some bad experience with one hospital staff, just one. But my experience generally has been good, in Korea. And it's same for every other person, it has generally been good. They have hospitals where they even, they have NGOs and the rest that even help to support people who are not able to meet up with their financial, like they're not able to meet up, with their hospital bills. They even treat some people for free. They have Red Cross and the rest that assist people to pay for hospital bills, even give some particular treatments for free, So I think the healthcare system in Korea generally is good. Their medications are effective, and they follow up your treatment, like to make sure that they see it to the very end, to make sure that yes, you are actually doing good, you're actually doing fine before they let you go. So I feel like their the healthcare system in Korea, what I can say is really good, it's really nice. So if you're considering going somewhere for treatment, maybe you could consider South Korea. Korea is really good, trust me. I don't know about, I'll say what I know about only I'll only say what I know about Korea, and their healthcare system is good and it's effective. So that's my honest review about the healthcare system in Korea. So first of all, if you have your insurance, which is the government insurance, trust me, you'll be fine when it concerns medical bills, as well as those who are lucky to be in the other cities where they have the free healthcare system, especially for foreigners. Yeah, they just go to those hospitals and get treatment for free. So yeah, that's my honest opinion about the healthcare system in Korea. So if you have any other questions or things you might like to know, you can drop it for me in the comment section, and I'll connect with you to, like, I would like to know what you think. I would like to know your honest opinions. If there's any other thing you would like to know, you let me know. Okay, so I don't want this video to go again longer than this. So let's just end it here. Thank you so much for watching. I hope you learned something new about Korea. I'm going to be doing more videos, okay? As the requests keep coming, I'll be doing them. So hope you enjoyed this video, and thank you so much. Stay tuned. Please don't forget to like, share, subscribe, turn on your notification bell so you get notified each time I post a video. In this season, I'm going to be very consistent, okay? So until next time, stay blessed. Please share me out. God bless you. Bye bye.